I am Myla Tracy Cantoja, first-year nursing student at Central Mindanao University, and today I am going to demonstrate the procedure for oral drug administration. But before that, we're going to do an assessment, which is to assess the ability of the patient to swallow the medication drug and to assess the patient's knowledge of the medication that he or she is going to take. For the possible nursing diagnosis, number 1 would be deficient knowledge, and for the second one would be the anxiety of the patient. For the materials needed for this procedure, we're going to be needing the drug, of course, the medication that he or she is going to take, the alcohol-based hand rub for hygiene, and of course, the water. And since you're all set, we're going to start with the procedure. Procedure number 1 is to verify the practitioner's orders, review an accurate list of all of the patient's medications and supplements and allergies, which can be found in this one. Doctor's orders or practitioner's orders. This helps in identifying errors that may have occurred when orders were being transcribed. We're going to check it now. It is all set. So for procedure number 2, know the actions, adverse effects, side effects, and nursing responsibilities related to the drug. So now I'm going to show you the medication that the patient is going to drink. This is a vitamin C, which is a sodium ascorbate Fern C 500 mg capsule. This is for prevention and treatment of vitamin C deficiency, hastens in wound healing, and increases body resistance from infectious diseases. By knowing this knowledge, it aids nurses in evaluating the therapeutic effect of the medication. We are now going to proceed with the procedure number 3, which is to wash your hands, or you can apply the alcohol-based hand rub. Procedure number 4 is to gather the supplies and check the medications. This is for us nurses to have an easy access of the supplies, and it ensures the safety of the patient. And now, since we've already gathered the needed supplies, we're now going to proceed with the procedure number 5, which is to compare the doctor's orders with the medication ticket and the medication ticket with the medication. I'm going to compare it. Sodium ascorbate Fern C 500 mg. Doctor's orders, medication ticket, ascorbate acid, Fern C 500 mg. It is now confirmed. And now we're going to proceed with the procedure number 6, which is to check the expiration date of the medication. I'm going to show you. So this is the expiration date. It is indicated here. It is 4/22, which is on April 22 next year. It is still consumable because today is March 2021. So expiration date indicates the period that the medication remains consumable or usable. So now we're going to proceed with the procedure number 7. Procedure number 7 is to perform the standing 3 checks of the drug. This is by comparing the medication ticket with the drug labels. I'm going to show you. This is to ensure the patient's safety and to know exactly that the drug is still consumable and in good state for medication for the patient. That is good. And also to calculate the dose, have it to check with another nurse after you've done calculating it. So my calculations is 500 milligrams. It is correct with the medications, and I will be back. I'm going to recheck this with another nurse. I will be back. And now I'm back. So we had the same calculations with the other nurse, 500 milligrams. And now we're going to proceed to procedure number 8, which is to prepare the medications on the medication tray. So there are 2 types of medications that we're going to be using for this one. We have the liquid and the capsule or tablets. So for liquid medications, you need to pour it on the medication cup and read the measurement at the bottom of the meniscus eye level. Since the table is short, I'm gonna do it at the eye level. And for the capsule or tablets, you need to place the tablets and capsules on the medication cup. But do not open yet the wrapper until you're on the bedside, because you are not allowed, or just never touch the medication with hands because it can get contaminated. So by following these steps, it helps for easy conduction of medication, and organizing everything in a medication tray helps in transporting the medication safely and efficiently. Now I'm going to cut it, but I'm not gonna open it. Put it on the cup. Here's the medicine, the water. And now we're going to proceed to procedure number 9, which is to transport the medication to the patient's bedside table. But before that, I am going to demonstrate the procedure when you are using a liquid medicine. So first thing, you need to calculate the dosage that you're going to give to the patient. So I'm going to give a 3 ml. I've already calculated it, and we check it with my coners. And so this is the container. I've already checked the expiration date and the name from the doctor's orders and the medication ticket. So now I'm going to put it here in the cup. And see if it is in 3 ml. By looking at the bottom part of it, through eye level. Okay, so since the table is so low, so we're going to adjust ourselves. So now it is 3 ml. And now we're going to put it in the tray along with the tablet to give to the patient. You need to do it carefully to avoid spillage of the medicine or the water. Let's go! Hi ma'am, I am your nurse for today. I am Myla J.C. Cantoja, and today I am going to give you your medication. After introducing yourself, you need to proceed to procedure number 10, which is to perform a hand hygiene to prevent the spread of microorganisms or contamination. Procedure number 11 is to identify the patient, of course, by asking the patient his or her name, and ask her birthday, ask her to state it, or you can check the identification bracelet, which can be found here. And if the patient can identify his or herself, verify with the staff members who knows the patient. Hello ma'am, ano yung pangalan ma'am?
Marlita Cantoja.
Kano sa yung birthday?
September 28, 1960.
Okay, thank you ma'am. This is to ensure that the patient is given the right medication to the right patient and to avoid any errors. And now we're going to proceed to procedure number 12, which is the complete assessment before giving, and also check for allergies, because checking for allergies ensures patient safety and to give proper interventions if anything bad happens. So now we're going to do an assessment. Ma'am, naka-allergies ma'am?
Kuan lang kanang penicillin.
Okay ma'am, penicillin. Okay. So now we're going to proceed with the procedure number 13, which is to do the last of the 3 checks of the medications by comparing the medication label with the medication ticket. So now we're going to check it. Here now, let's see. And also, you need to explain the purpose and action of each medication that the patient is going to take. This is to ensure safety and awareness for the patient and to establish a good rapport between the patient. Ma'am, I am going to give you a vitamin C which prevents and treats vitamin C deficiency, ma'am. So now we're going to proceed with the procedure number 14, which is to position in sitting upright the patient. This is to make sure that the patient is comfortable while administering the medications. Ma'am, I'm going to assist you in the sitting position, so gently. Yeah. So procedure number 15 is to administer medication and offer water. This is to properly swallow and intake of the medication drug. We're going to give first the liquid. Procedure number 16 is to remain with the patient until each medication is swallowed. Never leave medication at bedside. This is to ensure that the medication is swallowed by the patient. And now I'm going to assist the patient into its comfortable state. Okay. Procedure number 17 is to evaluate and document the procedure. This is to keep data and records of the patient. Vitamin C taken at 11. And now we're done with the procedure. Don't forget to pray. Thank you for watching.